I'm Dr. Eliana Castillo, a physician working at the University of Calgary in Canada. I have been caring for pregnant individuals with medical problems or infections for 20 years. I took care of very sick moms during the H1N1 and the COVID-19 pandemics. And because of those experiences, I want to share with you why it is important to get vaccinated during pregnancy. The most common question I get from my patients is about safety. Is this shot safe for me? And is this shot safe for my baby? And the answer is yes. The vaccines that are recommended during pregnancy do not increase the risk of birth defects, do not increase the risk of miscarriages, do not increase the risk of going into labor earlier or having other pregnancy complications. All these complications may still happen because they were going to happen for other reasons, sometimes for reasons we don't understand. We do know that vaccinations during pregnancy do not increase the risk of those complications happening. Your well-being goes hand in hand with your baby's well-being. If you ever find yourself thinking, oh, it's okay if I get sick as long as my baby doesn't get sick, please know that if you get sick, it's going to be harder for you to properly nourish your unborn baby. When you're pregnant, your whole body is working hard. Your heart is pumping blood for two. Your lungs are breathing for two. When you get an infection, your whole body has to work hard to fight the infection, which also makes it hard for your lungs and your heart to work. So if you get an infection when you're pregnant, the extra work from both the pregnancy and the infection is a lot on your body. And that combination makes it harder for you to support your unborn baby. The good news is that we have vaccines that can prevent you from getting an infection. Vaccines and its components stay in the arm after you get vaccinated. The components of the vaccine itself are cleaned by the normal cleaning systems we have in our bodies. The protection that your body makes after getting a vaccine goes to your baby. The vaccine and its ingredients do not. Vaccines use what Mother Nature already has in place to protect your baby when most vulnerable. Mother Nature knows that when your babies are born, their defense system is very immature and that they need extra protection during those first few months in life. So, Mother Nature created a system by which all the protection antibodies that you have in your blood, including those antibodies that your body will make after getting a vaccine, will go to the baby through the placenta. When you enter the last trimester of your pregnancy, the placenta transfers all the protection antibodies you have to your baby. So when your baby is born, your baby will be protected until they are old enough to get their own vaccinations. Even if you cannot breastfeed or breastfeeding is not the right option for you, please know that by getting vaccinated during pregnancy, you are already protecting your baby. And if baby cannot get breast milk, they will still be protected. Vaccines recommended during pregnancy are safe and well tolerated. The common side effects from a vaccination, like the pain in your arm or feeling unwell for a day, will not harm your baby. There are real risks from getting an infection during pregnancy for you, and there are real risks to your baby if they get sick soon after birth. Making decisions during pregnancy is difficult. Making decisions regarding getting a vaccine or not during pregnancy is also difficult. As a mother myself, as an auntie, as a doctor, and as a researcher, I want to tell you that we know enough about the risks and the benefits of vaccination during pregnancy so you can make a confident decision that will protect you and your baby. Remember, vaccination for you is protection for two.